Hey everyone, this is a video request on how to organize your day or night shift as a new nurse. And I know this doesn't have anything to do with passing NCLEX right now, but ReMar Review is about making you guys awesome nurses. And I do that by providing NCLEX products, but I also want to make myself available, make my knowledge available so that you guys can have a happy nursing career and you can love it and want to teach others how to be great nurses too. So this is one of those videos where I do want you to get out a pen and paper and take notes, because this is a skill that is learned and not one that you just fall into. I mean, organizing yourself, it's so important to have a foundation or a structure to do this as a new nurse, because you are expected to complete several things during your 8 or 12-hour shift, and if you can't prioritize and organize, you're going to be very frustrated. You're going to be staying after work longer than you have to, and you won't be getting paid for it. So let's just start with the 3 initial contacts that you must make with your patient, okay? And this is how I look at it. When I come on to a shift and I get a set of patients, I know I have to make at least 3 contacts with those patients, all right? Those 3 contacts are, number 1, rounds, number 2, medications, and number 3, treatments. And I know you guys are like, what is she talking about? So let's talk about rounds first, okay? So the first time you go around to see everybody, in your initial contact, you should be doing these things, all right? You should be introducing yourself. You should be assessing your patient, okay? You should be taking their vital signs, including pain, as well as asking them, is there anything else you need? When I come back into the room the next time, what do you need? Do you want more water? Do you want blankets? Okay, this is the time when you are gathering requests, because remember, the second contact that you're going to make with that patient is your medication contact. All right, so like I said, the first contact is the initial one. You want to do vital signs. You want to introduce yourself, okay, assess their pain, any requests that they need. Also, what was I going to say? Also, check their IV out, okay? Make sure you have a patent IV, because you might have to come back with an IV medication, and that's not the time to realize, oh, your patient's IV is not functioning properly, okay? So you see your patient, you do your initial contact, which is called the rounds contact, and then you leave and you go on to the next patient, all right? After you see that patient, always document. If you have your clipboard, write down what did they want, what did you assess, because a lot of you guys are waiting till the very end of your shift to document everything for the whole day, and that's a no-no, okay? Because you don't remember everything. So right after every contact, you should write down your thoughts, what you saw, what your patient needed. So when you go back to write your note, it's right there, okay? Also, don't be afraid to put the time down, because you might forget. Okay, so we've done our rounds assessment, number 1. We're coming back to our patient's room, and we have our medications, okay? So during the medications, you are doing your education, all right? You're about to educate your patient on every medication that you're giving them, okay? You're also coming back with the things that they requested that they needed. So when you bring in medication, make sure you have a pitcher of water. Your aides may or may not have done that. When you're doing your medication, be prepared to take your patient to the bathroom, because if you're giving them a blood pressure medicine, you don't want them up walking around necessarily right after you've given them that. So this is the second contact, all right? So medication, second contact is very simple. When you leave there, you're documenting. Medication was given. Pain medication was given. I will reassess them in a half an hour. Okay, patient had no complaints. What else did I want to say about the rounds? Okay, food as well. If you're bringing medication in, sometimes patients need to eat with the medication. So have your graham crackers or have your milk or whatever it is that you are going to give your patients as well. All right, and this is about organization, because if you know what's coming up next for this patient, you can anticipate their needs. So when you get into the room, you're not like, oh, I forgot this. And patients will respond to this. They'll say, wow, she's really organized, or she remembered that I wanted such and such. Okay, so the second contact is over with. Now the third contact that you see, after you've given all your patients their medications, be prepared to come back and do all their treatments. I like to leave treatments last because sometimes they take a little bit longer. Okay, so in the treatments, let's write down my notes. Okay, in our treatments, we're doing wound care. All right, we're changing dressings, preparing, all the supplies that we need maybe throughout the day, bringing it in, and during your medication education, say when I come back again, we're going to dress that wound. Wound dressings took me a long time, especially if they were in the legs and the patient was heavy and I had to get somebody to help me. Nurses, they don't mind helping you, but at the beginning of their shift, they're not going to be down to help you do a wound change when they have their initial contact and their rounds to do, their medications to do as well. So wound care, incentive spirometry, ambulation, any kind of treatments that need to be done, you want to do that, your third time essentially in your patient's room. And I'm saying 1, 2, 3, but we know as nurses you may be in your patient's room more than that, but try to use this as a structure to schedule your day. So during the treatments, you are saving, the most time-consuming tasks for the end. All right. And then again, as well, you're documenting after every contact. Even if you can't write it physically in the chart, write it down on your clipboard. So when you sit down to close your nursing notes for the day, you've progressively given a picture of what your patient's day has been like. And at the end, you're not trying to write this whole day-long synopsis of what happened. Okay. So I hope that helped you guys kind of think about it and adjust it to what you think is best, because nursing is not about, I have to be just like so-and-so. You have to do what works for you. I'm just giving a general synopsis, but I don't know what your working environment is like. I don't know if you work on rehab or if you're working in the MICU. So use it for you so you can be the best nurse that you can be for your patient. And that's all that matters. Okay, see you later. Bye-bye.